So Governor Kathy Hochul will present her executive budget next week. In it, we can expect to see more money dedicated to mental health and public safety, particularly for our subways, as she outlined in yesterday's State of the State speech. Listen.
People should be able to get to work in the morning, attend to play, enjoy restaurants without the fear of random violence or dodging someone in the midst of a mental health crisis. We cannot allow our subway to be a rolling homeless shelter.
So earlier this week, New York City Comptroller Brad Lander unveiled his own plan on how to make the city safer for all by addressing the homelessness and mental health crisis impacting New Yorkers. The Comptroller joining us now this morning with more on his plan. So great to have you here.
Great to be here. Thank you.
First I want to get your reaction to Governor Hochul's speech yesterday and her own subway safety plan, right? To have 2 cops on each train from 9 p.m. to 5 a.m. for at least the next 6 months. Your thoughts on that plan?
Look, people are feeling unsafe on the subway because of these awful incidents like what happened with Sabrina Kawam on Christmas Day when she was burned. And I went out with one of the subway outreach teams all over. You see people who aren't well and you worry, could that be me? So I understand the desire to have police in the subway cars. At the same time, if we don't do better at getting people into housing with services, they're going to be somewhere in the subways, in front of our apartment buildings. So it can't just be a policing strategy. It's got to be a housing strategy. This plan's Safer for All. We dug in and found we're putting housing last in so many places, sweeping people, but then they still wind up sleeping just somewhere different on the streets or subways for the night. Even when people are released from jail or hospitals, they don't get into supportive housing. So we're just moving the problem around. We need a housing first approach that gets those people into stable housing with services so they get better and so they're not there on the subways and on our streets.
But getting back to her plan, though, is it financially realistic?
I think her plan, we have to dig in on the numbers. That's what we do in the Comptroller's office. I believe what she's proposing is financially realistic. And I also support the increased flexibility for involuntary hospitalization that is being proposed because we do need some more ability there. But we're only talking about 2,000 people that we found in this Safer for All plan who have serious mental illness and are sleeping on the streets or subways or are in jail and hospital and will likely be homeless when they get out.
How'd you come up with that number of 2,000 when you look at it? It seems like there's a lot more.
It does. I was surprised to see that the numbers were so low, but the team really dug in. There's these homeless outreach counts that go out every year, and there's about 4,000 people sleeping on the street. About a third to a half of them with serious mental illness. And then we looked at how many people at Rikers, how many people in hospitals. So meanwhile, there are 2,500 vacant supportive housing units and SROs. There's a real failure of management and coordination from City Hall. Some of that is Department of Correction doesn't tell the Department of Homeless Services or the Department of Health when someone's coming out. So they just wind up back on the street or subway, and these vacancies in the supportive housing units and SROs are a real failure of City Hall management and coordination because what cities like Houston and Philadelphia have found is when you connect people to stable housing with services through this model called Housing First, they stay stably housed 70 to 90% of the time. That's how we ended veterans homelessness in New York City. It works. We're not doing it. That's still not what Mayor Adams is proposing. It is, good to have more police presence in the subways. It's good to be able to get people off the streets into hospitals when they need it. But if you don't eventually connect them to stable housing and services, you're never going to solve this problem.
Can you give us a few more specifics? You laid out a whole blueprint on how you plan to solve homelessness.
Yes.
Where specifically, first of all, are those 2,500 vacancies?
So those are mostly in what are called SROs, single room occupancies.
Okay.
A lot of them, built around the city, some, a lot in Manhattan, but all around the city. There used to be many more of them. Some of them have been demolished and replaced. But they tend to be small, kind of self-contained units, but they're exactly what people who are resistant to go to shelter want, a room of your own. People tend, once they get stable, to move out of them, which is why a lot of them are vacant. Once you get stable and you've got a housing voucher and you can move someplace a little bigger, people want to do that, but they're perfect to get people off the street.
So let me ask you this. The mayor today is making an announcement at 10 a.m. where he's actually talking about the $650 million investment. And many of those involves new beds. And he also has this plan now to take people out of hospitals and get them the mental health care they need in a facility now run by H&H. How does your plan differ from that?
Well, first I'll just say
is that something that you support?
Well, first I'll say that the mayor, the fact he's doing this announcement at Bellevue really speaks to how much it's too little, too late. The mayor was supposed to build an additional 360 secure detention beds for people who need hospitalization but are incarcerated. They're either at Rikers or in Department of Correction. And so they wanted to build 360 secure detention beds, starting with 100 at Bellevue. They were supposed to be online 2 years ago. This administration delayed the whole program. Not a single one of them has opened. So it's just too little, too late. More safe haven beds is good. The Just Home program of health and hospitals is good. The secure detention beds is good. But here we are in the 4th year of the Adams administration, and not a single one of those units is online.
Your plan that you're talking about, is this a plan that you want to enact as controller, or one that you want to enact if you were to become mayor?
Well, we've been doing the audits as controller of all these programs. We showed that the homeless sweeps program is not connecting anyone to housing. We showed that the intensive mobile treatment program that's supposed to help people stay on their meds and care, but it isn't working because too many people are falling through the cracks. So the audits and recommendations come from the controller's office. This administration is not getting them done. It is a big part of why I'm running for mayor. As mayor, I'll be focused on solving this problem every day.
All right, Comptroller Lander, thanks so much for taking the time
Thank
to speak
you.
with us
Great
this
to be
morning.
with you.
Appreciate it.